introducing themselves, but I have the pleasure of introducing my colleague, Matt Stagner. Matt is going to moderate today's panel, and he's Vice President and Director of Human Services here at Mathematica. He's a nationally recognized expert on youth development and risk behaviors, child welfare, teen pregnancy prevention, evaluation design, and the role of research in policymaking. I also would mention that he's president-elect of the Association for Public Policy and Management this year.
Okay, congratulations.
Today's format is a little bit different from a lot of our SIRE forums. As you can see, we're going for a more conversational, moderated panel that Matt is going to lead. And at the end of the initial conversation, we'll take questions from our in-person and webinar audiences. I want to say if we don't get to your question, we have a real bonus this time around in that we're going to follow up the forum with a Twitter chat. It's scheduled for Thursday, April 5th from 12 to 1 p.m. Eastern Time, and we'll use the hashtag #AllForChildWelfare. And we encourage everyone here in the audience today to join us in that event. You can learn more about the Twitter chat by following Mathematica at MathPol Research. One bit of housekeeping that I want to cover very carefully is that we're going to do some polling during today's event. It's a great way for the audience to engage in the discussion. The webinar audience will see the poll launch automatically on your screens. For everyone here in the room, you should have received an email with instructions on how to log into the webinar to engage in the poll. You can feel free to refer to that email now, or also in your packets here, there are instructions for how to log into the webinar. Our moderator, Matt, he'll announce the polling results throughout the event today. And if you have any trouble logging in, my colleague Leah is here in the room to help folks with that, and also online audience has Bryce to help. One last bit of housekeeping before we get started. We are video recording today's event so that we may capture images of some of you here in the room. The video will be posted on Mathematica's website within a few days, but in the meantime, to help ensure high quality sound, we'd ask that everyone please silence your electronic devices. With that, I'm going to turn it over to Matt Stagner. Thanks.
Thank you so much, Anne. Welcome again to everyone. Thanks to Anne and SIRE for putting together this panel. Thanks to the Mathematica staff who support it, but thanks most of all to our panelists who came from near and far to join us in what I think is an incredibly timely conversation. This has been, the use of research in child welfare has been a concern I think everyone on the panel has worried about for decades. And I think it's fair to say that in the last few weeks, there have been some changes that make it an even more pressing issue. And we hope that we get a lively discussion among the panel, as well as with the audience here in the room and on the web, and that we all learn from each other. And we may end with more questions than we have answers, but I think we'll all learn a lot from this. So I wanted to begin actually with one of the polling questions, and then we will do our introductions while you guys are trying to answer this poll. So our first one is just to help us get a sense of who's in the audience today. Which of the following best describes your primary role in your job? Are you a practitioner, a policymaker, a researcher, or a funder? So answer that, and we'll come back and look at that. But I'd like to first turn to each of our panelists to take just a couple of minutes to introduce yourself, your organization, and your role. So I'll start with Kim.
Hi, I'm Kim Dumont. I'm the Senior Program Officer at the William T. Grant Foundation. The foundation was founded in 1936 as a private grant-making organization. And its founder, William T. Grant, was the owner of a 5 and dime store who cared very deeply about youth and had a number of probing questions about their development. So since its inception, it supported research to improve the lives of youth. And the way that we keep the foundation current is to focus the research areas that we fund on pressing issues of our time. Right now, we're focused on reducing inequality in youth outcomes, certainly a topic of great importance today. And very relevant to today's conversation, we recognize that there's considerable distance between the research that we invest in and youth outcomes. So we fund studies to identify, build, and test strategies for improving the use and usefulness of research in decision-making in ways that benefit youth. And on a more personal note, I would just say I'm here today because I care really deeply about children, youth, and families. I've been working in this space for 20 years, and I really welcome the opportunity to connect with others and think really strategically and proactively about how we can better connect research, policy, and practice to benefit families. Allison?
Thank you.
So well said. I'm Allison Metz. I direct a research center at the University of North Carolina at Chapel Hill called the National Implementation Research Network. We're based at the Frank Porter Graham Child Development Institute, where I'm also a senior scientist, and I'm a professor in the School of Social Work, also at UNC. So it's getting through my affiliations. In terms of the National Implementation Research Network, and we just kind of go by the acronym NERN, our center is really focused on building both the science and practice of implementation to improve outcomes for the populations we work with. The center was really founded around supporting the replication and scaling of manualized evidence-based programs. That was about 15 years ago. The center's mission has expanded well beyond evidence-based programming, and so while we still do work in that area, we do work around developing practice models and working with communities to both generate research evidence and then be able to use that to improve outcomes. Just to kind of say where our center is really focused in the last couple of years is around an issue that I think is really critical, which is the practice of implementation. So what are the skills and competencies that are needed to really support effective change? We're also doing a lot of work around evidence and equity. So that has to do with participatory processes that are used both to generate evidence and then also to support the implementation of it. And then finally, our center is doing quite a bit of work on measurement, so how it is that we actually measure capacity. So I'll just leave it at that.
Great. Hi, everyone. I'm Kelly Sackter. I'm a licensed clinical social worker, and I work as a director of programs at Family Connections. Family Connections is a private nonprofit agency that is from New Jersey, and we have over 35 different programs serving individuals, children, adults, families from age 0 to 100. And so my goal at being here today is I've had the pleasure of working with a lot of the people sitting on this panel in looking at how do we bring together different systems. And a lot of my programs are contracted with the Department of Children and Families in New Jersey. And I've had the pleasure to partner with NERN to learn more about implementation science and how we could really improve the services that we're doing, make sure that they are implemented in an effective way when we're using evidence-based programming. Because at Family Connections, we are committed to providing trauma-informed, culturally competent, and evidence-based services, as well as helping to promote innovative services in a way and implement them in a way to have excellence for families and children.
Okay. Good afternoon, everyone. I'm Allison Blake. I'm also a licensed social worker. And most recently, I served as commissioner of the New Jersey Department of Children and Families for about 7.5 years. And during that time, I had the opportunity to work with just about everyone sitting here on the panel with me. We were a system that was undergoing significant reform in our child welfare agency. And we saw as a result of that reform a really dramatic shift in the population of children and youth we were working with in terms of their needs and the problems their families were facing. And so there was an opportunity for us to really think much more intentionally about the types of services and programs that we were providing, where we could really think about what are the outcomes our children, youth, and families are trying to achieve, and how can we better help them do that. And so that really was our foray into the use and funding really of evidence-based and evidence-informed programs. Prior to my time as Commissioner of the Department of Children and Families, I worked at Rutgers University, but also worked in the nonprofit sector. And I'm happy to say that I started my career as a caseworker in public child welfare in Ohio. So very happy to be here today.
Hi. Good afternoon, everybody. My name is Peter Pecor. I'm with the Casey Family Programs. I lead their research services team and also serve as a professor of social work at the University of Washington. Casey Family Programs is the nation's largest operating foundation that's focused on safely reducing the need for foster care in America, as well as building up communities of hope across the country. We were founded in 1966 by Jim Casey, who is the founder of UPS Corporation. And we work in all 50 states, the District of Columbia, the Virgin Islands, and Puerto Rico right now, and have agreements with 15 tribal nations. And basically what we're doing is we're trying to help those systems, and we've had the honor of partnering with Allison as she pioneered a number of breakthroughs in crisis mobile mental health services and a number of different innovations in child welfare, just two small examples of what New Jersey has accomplished under her leadership. But we have a chance. What we do is we partner up and try to provide technical assistance to state and county child welfare agencies to help them refine their programs. The research services team today has put together the research catalog that we'll refer to a little later in the panel. And we've learned a lot from Kim and Allison Metz around the implementation and research utilization aspects of today. So we're pleased to be here, and thanks for having us.
Thank you. So you can see from our distinguished panel that we represent all forms of intersection of policy, research, and practice. That was intentional, not an accident. And so I'll turn to Carmen for the results of our poll to get a sense of the audience.
Thanks, Matt. So for those of you in the room, we apologize for this teeny tiny little font. So let me just read what you see up here. Researcher is the highest percentage at 60%. You then have practitioner at 18 or 19%, policymaker at 13%, funder at 8%.
Thank you. So that's interesting to know and will help us, I think, guide the conversation. So I will be asking a few questions of our panel, and we'll engage in conversation. As you think of questions, we will give back to you and give you an opportunity to engage as well. But I really wanted to start off with the biggest possible picture. We all know that child welfare, if not the, is one of the systems that daily makes thousands of decisions that have just a tremendous impact on children and families in our country. It's hard to imagine a system that has a more dramatic impact on children and families in making the decisions that people make. So we would love to see the best research, the best practice brought to those decisions. And I wanted our panel to reflect on the ways we do see research evidence used, how it is used from their experience, and where it isn't used or isn't used as much as we would like. What are some of the issues that make that happen? So I'm going to turn to Peter to kick off that discussion and encourage the rest of our panel to jump in.
I think that the stakes are higher now as more states and as the federal government through the recently passed Families First law, and as states have passed either laws or administrative regulations that require the use of research-informed or evidence-based practices. I think the stakes have been raised for demanding that we better use research information. And just think about it. Research evidence can or should be at least informing what assessment tools and processes are used right at the front end of working with children and families. So around assessment tools and process, as well as the interventions that should be used to help meet those child and family needs, and for how long, with what kind of duration should those services be provided. So those are just two examples of where we would say, hey, research evidence, research data really needs to help inform that work. Around gaps or needs, I know the panel here will fill this in even better, but I think we still have a great need to provide frontline staff with the information that they need about what are evidence-informed clinical strategies that they ought to be using, or what types of evidence-based programs should they be contracting for or referring families out for, because I think many times our frontline workers and our supervisors, some of which turn over too quickly, they don't have the information they need at that line level, at that decision-making level, to make smart decisions with youth and families around which interventions to use and for how long. So those are two.
Great. Allison, you wanted to
Yes,
jump in?
I'd just like to build on what Peter was saying. I think that, traditionally or, historically in public child welfare, I do think that research is present. It's been part of the development of structured decision-making tools and other types of decision-making tools. I think that the real shift that we've been seeing in recent years, and hopefully we'll see now with the Families First Act, is around more research-informed practices, right? So the implementation of and support for services that are evidence-based or evidence-informed. Traditionally in child abuse prevention, we have a wide service array available to support children and families in the community. We see similar strategies in children's behavioral health, but I think in traditional child welfare settings, we don't have a wide array of evidence-based services or programs, and I'm hoping we're going to get to that now with the Families First Act.
Kim?
So I'd just also like to add, I think it's easy for us to talk about uses of research when they're very packaged, when it's packaged nicely in the form of a risk assessment tool or in an evidence-based program. But I think there are also important opportunities for research to be used in thinking about how a budget gets allocated, in thinking about getting a deep understanding of the nature of a problem, in developing that response to it. And we can call on bodies of evidence or use research syntheses in addition to the evidence-based programs and packages and tools and things like that. And I would say that in terms of the gaps, that I suspect research is used every day in child welfare settings. Sometimes it's not articulated because it's already been baked into the practice. And there are a lot of variation across states, across counties, across individual agencies in their use of research evidence and at the different levels of the system. And so what I would hope is that it would be more routine and the use of that evidence would be focused on the outcomes rather than the use of the evidence itself.
Yes, and I think
Kelly, and then
yes,
Allison M.
as a practitioner and as someone that's providing services for families that come into the child welfare system, often when we're applying for RFPs, we're looking at the evidence that exists in particular programs. We're looking at a particular modality, but once we start implementing it, it really is an ongoing creating smaller research projects and looking at quality improvement and how can we improve the outcome in this particular service. What other things can we look at outside of what already exists in literature and what already exists in the research. And I think also there is a lot of things in child welfare that there isn't a lot of research about, such as visitation, where we have some information about visitation, but we need to expand on what works and what helps permanency outcomes and how can we structure the way we do visitation differently. And so utilizing a system such as implementation science to really look at what we're doing and why we're doing it and what's the infrastructure to support that, so that way we could really measure the outcomes is important.
I was thinking actually about what Kim was saying about what we use evidence for. And you made a point about using a body of evidence to answer different types of questions, and one might be how we define the problem from the very beginning. And I was struck by that because I was actually just reading an article last night. I think it just came out this week, and it's in children. The context is children's mental health. I think there's a lot of parallels to child welfare, and it was looking at public agency leaders' perceptions around the sustainment of multiple evidence-based programs. So the reason that was such a critical article was because most studies that are done on single evidence-based programs in kind of an isolated context. And they're often actually looking at practitioner perspectives. And so this was looking at both executive leaders, so that'd be kind of commissioners or deputy commissioners, and then looking at folks that were senior management. And one of the biggest predictors of a lack of sustainability of evidence-based programming was leaders' perceptions that the evidence-based practices or evidence-informed practices that were selected did not meet client needs. And I just found that really interesting because I do think how we define a problem in the very beginning is a very fateful decision. So the types of evidence that we both generate and use to identify need is such a critical piece of, I think, the puzzle around how we are using evidence to inform decisions that do have, again, a very kind of fateful trajectory. And I know that might seem odd, but the sustainment of a lot of evidence-informed practices is very low, both in this country and in Europe. There's a lot of uptake and very little sustainability. And this idea of the match is something that seems to come up a lot post-selection. And I think we want to take a look at both those selection processes, but very specifically the evidence that we are able to draw upon to make early decisions is something I think that's really important for systems.
Wow, that covered a lot of the waterfront.
Yeah.
Peter, did you want to reflect on any of the other comments, or?
Just to double down a little bit on what Allison mentioned, I was just thinking about how important, and Kim mentioned it as well, that this unpacking and a careful assessment and really understanding the data and the needs driving a situation are. Because you think about the more well-informed our line staff and their clinical consultants are, I think the better we will see less families being assigned 22-session parenting programs, and instead we will see, if the worker's coming at this from a very careful, data-informed, safety-oriented assessment, we'll see less assignment or requirements for 22-session or 19-session parenting programs, and instead we might find families being provided with 4 sessions of a very targeted in-home parent coaching intervention. And that's what the example just sprung to mind about the comments and if there's as Allison just mentioned, if there's a greater array of evidence-based interventions to choose from, workers won't feel this compulsion to choose, if everything's a nail, if all you have is a hammer, everything's a nail. It's this whole notion of having choice, and then the data and the information needed to make a good choice. I think we'd have better services provided. So that was just reflecting on people's great points there.
Wanted to turn to Kim specifically because WT Grant has been a leader in this issue of research use and the connection between research and policy. And I found a quote on the website. It's a good one.
Okay.
Research is never used alone. It is always integrated with other types of knowledge. And to me, that just summed up the complexity and nuance of research use that we often miss because we think we create research and then we hand it to somebody and it gets used. And I really appreciated your baked-in comment. I wanted to call attention back to that because this notion of how you make it part of practice, not something separate, but it's sort of your approach every day. So I wanted you to reflect, because I know you know about other fields, and WT Grant does a lot of work in the education field. What is it that makes child welfare different or the same? As you work in child welfare, what comes to mind as the ways research is combined with other types of decision making, and how do you put research forward?
Okay, so I think that was at least an 8-part question.
It was.
And
We get 3 of them.
I'm going to go for the 3 I want to. How about that? So first, I'd like to say that it's a good quote. I agree with that there are a lot of kinds of evidence that exist in any system, whether it's education, public health, mental health, or child welfare. There may be differences in the emphasis or the extent to which, particularly in child welfare, there's not as much research that started in a child welfare population. It often is imported from other systems. And so that makes a particular challenge when you're trying to integrate the evidence from research with child welfare systems, because it didn't necessarily start there. But I want to start by saying I think we know a lot. I think the professionals who are delivering and meeting with children, youth, and families every day know a lot about the needs of those children and families. They know a lot about the systems that they work in. And they have their own theories of change about how to fix it. Likewise, researchers know a lot, and the bodies of evidence that we have on can contribute to challenges. What we need is to figure out how to respect both of these types of evidence and expertise and find a balance for integrating. And I'd like to give an example that came up as I was thinking about this. So researchers have spent a lot of time developing risk assessment tools, screening tools for depression, mental health, behavioral problems for parents, for caretakers, for children. And they have gone to the great extent to think about the order of the questions, the wordings of the questions, how the patterns of results that you see, whether it indicates an urgent need, the extent of services, and so forth. That's what research has to contribute. That tool in and of itself depends on the evidence and the professional expertise the clinician has in administering the instrument. A report is needed to make sure that the youth disclose the information in a truthful way, to access painful or uncomfortable information, to stop an interview if the distress level is too high. Our challenge is to figure out how to respect and integrate both those pieces of evidence. So I'm going to sit here and say I have quite a bit of hope that we're on a good path. We and other organization funders have funded quite a bit of research around understanding the conditions that promote the use of research evidence. And 3 of the conditions that are often spoken about cut across all systems and has been mentioned by every single panel member already. One is that the research needs to be designed with the end goal at the outset. So this means, what are the needs and questions of the decision makers? What are the constraints of practice? What are the constraints of the budget, the training, and so forth? We need relationships. Those relationships are really important for sharing information across a system so that it's not isolated in one space, because that doesn't do others any good. We also know that your connections in your professional networks have a lot of influence on how you appraise evidence in terms of whether it's relevant, whether it works, the value of it, its credibility. And we also know that these peers in our networks make a difference to the use of evidence, who you can call on to help support it and do that work with practice. And the third piece that we have is that engagement is very important about research. This is sustained, repeated conversations, deep deliberation, reflective practice, and being able to iterate. That to get handing off a piece of evidence today, what I say, and not following up on it in any way, not reading anything, not having a Twitter chat, not calling to any of these, it will be gone. It will not make a difference to practice. We know this, it comes up over and over again. So as I was thinking about today, and I went back and read through a number of recent grant proposals, a number of articles, the strategy guide, and I would put the strategies for integrating research evidence and practice expertise and policy expertise into 3 buckets. One are research practice partnerships. Research practice partnerships are very promising because they are, I'll define what it is. It's a long-term, mutualistic relationship that is based on a problem of practice. The value of a research practice partnership is that because it's anchored in practice, it can focus on improvement, it can be a vehicle for providing the research syntheses to help understand the nature of a problem, it conduct evaluation, it could be flexible in terms of what it's doing. It builds those trusting relationships, it should build good communication paths, and so forth. It incorporates all those pieces that we know about. It's hard to do, and others will talk about that, but that's one. A second bucket I would put is the work that Allison and Metz and Nern does about using multiple stakeholders to co-define and co-respond to a problem. This can be done within an organization where you reach out across an organization to involve people in collaboration. You set up systems so that can jointly define what the problem is. You develop a series of tools and work sessions to make progress on that problem and to iterate about what you're learning and figure out how to integrate it in practice. It can also be done across systems. So child welfare leaders are often very isolated, and it's not easy for them to work with their peers. And Lisa Saldana and Patty Chamberlain had developed the community development teams, which cut across organizations to create the same kind of work that Allison's going to describe, but it was across rather than within organizations. And then the last group of what I would call strategies are folks who are identifying existing routines and relationships and redesigning them to embed research into those routines and relationships and building a suite of tools to continually orient people. So Bruce Torpedo's work, in which he looks at the relationship between a mental health counselor and the supervisor and the supervisee, and a suite of tools to help them call on research, particularly around youth engagement, to better engage youth, and then to see how that carries out in practice. So those are the three strategies we need for the researchers in the room. We need tests of those strategies. We need to know when they work, if they make a difference to youth outcomes. But I think there's great promise in this area. And I was long, sorry.
That is great, though, because it really lays out and explains, especially on that last one, the kind of what you mean by baking into the process, the use of research. I'm going to pause to ask a polling question, and then I'd love to get responses from the rest of you to Kim's comments. So our next question is, what is the most important issue discussed so far? And we have a few choices there around the challenges facing child welfare agencies, the need to build research practice partnerships, the culture of evidence, or best practices for using research. So while you're answering that poll, I'll ask Allison, Kelly, any responses to Kim's answer to my 8-part question?
Do you want to? Sure. So as Kim was talking, it made me think of so many things, right? And so much of the relationship building that went on with the folks sitting here today. I think that it's important to understand that child welfare agencies are very busy places, right? And I say this a lot when we talk about the use of research evidence. And so it's, the leadership of the organization really needs to find a way to create space, right? To carve out some space where they can be very intentional about developing relationships with research partners and, but also thinking about how to integrate the use of evidence-based programs into the daily work and the daily life of a child welfare agency. Because if you don't do that, then it just feels like one more thing that's layered on top, right? And I think that, something that's important in terms of the relationships that Kim talked about, the relationship between a researcher, a scholar, and a practitioner or a policymaker, it needs to be reciprocal, right? It needs to be bidirectional, right? And so, when I think about the work that in New Jersey we were doing with Allison, Metz, and Nern, right? that was, we were able to go to NERN and say, these are the things that we're concerned about. These are practice areas where we're not seeing the results we were hoping to see. Can you help us develop strategies to better understand this and to really better support implementation of these programs and services? And Allison and the team at NERN were incredibly responsive. And so when you have a good result like that, right, at first, then you begin to build on that and you build that trusting relationship, and it starts to be kind of infused across the organization. I'm going to stop and let someone else talk.
Well, and just as someone that got to be a partner agency working with DCF and being able to take advantage of how NERN came in and was able to work with us, really partnering with the Office of Strategic Development at the Department of Children and Families to create programs, to look at them from the very beginning, to create logic models so we know what we're doing. It really was amazing to see how that partnership and how that teaming continues to play out and how we're able to get feedback bidirectionally to continue to improve decision making.
I'm just going to jump in, and because I think I have a few things I want to say. I'm going to, but I think what's really critical about a lot of these comments is operationalizing at the level of saying and doing what it means for there to be practice, research practice partnerships. And one of the things that I feel like I've just recently learned is the overuse of the word collaboration. Because if you look in the field of co-design or co-production and you look at scholarly work in those areas, there are different types of participatory processes that people will really talk about very precisely. So are you informing someone of something? Are you involving them, meaning you're wanting to get their feedback on a potential finding or barrier? Are you actually collaborating, meaning you're kind of making decisions together? Or are you actually co-creating, which means you're empowering another group, often marginalized, to actually make those decisions? And those are very different types of participatory processes that I think are effective at different points in the production and implementation of evidence. And so I'm not going to talk about them hierarchically, but I do think it's really important that we are very aware of what type of participation are we engaging in, and that we aren't labeling something as collaboration when it's actually not. And so I think, as Kim was defining what a partnership is, or Allison and Kelly were talking about this bidirectionality, there is a way that we can start to operationalize the practice of practicing collaboration. And what does that mean in terms of frequency of interactions, types of interactions? And then I just wanted to give a really quick concrete example, because I think it might have been put out as a handout, but we had done some work in New York for about 5 years that was supported by KC Family Programs. Actually did some analysis on that was supported by the William T. Grant Foundation around bringing stakeholders together around the scaling of evidence-based programming. And Kim pointed out that a lot of the evidence-based programs or other types of research evidence used in child welfare aren't grown in child welfare. So New York was using 11 evidence-based programs in their preventive services, only one of which was developed in a child welfare context. Because they were all evidence-based programs, they came with logic models. But those logic models said nothing about safety, permanency, and well-being because they weren't intended to achieve those types of outcomes. So we had to essentially rethink the theory of change. And rather than one stakeholder group doing that and then seeking feedback on it, we did something that in the co-design literature would be called joint prototyping, which meant that all those stakeholder groups came together to re-theorize the logical linkages between the use of those models in this context to achieve short-term and long-term outcomes that were specific to child welfare. And I believe that that little example is one of many that were used in New York that have in fact led to 5-6 years later, which doesn't seem like a long time, but it actually is in the life of an EBP, which often can't make it through a new administration. And you know, there's been 3 commissioners in New York, and those EBPs have stayed. And the report, I think, that is here, and Peter, I'm not sure if it is, shows that there are child outcomes in New York now, specifically for high-risk populations. And so I can't make causal linkages between those things, but I can say that I really believe that authentic stakeholder engagement that we were able to operationalize in the way I'm describing led to some of the conditions that supported sustaining those. I was careful in my research words there. Yes.
Thank you. And just
See how well I summarized
and
that.
to further, if you look at the literature on the community development teams, they similarly find that these collaborations, these peer exchanges, working jointly to identify and solve problems, and having access to research and experts who can iterate on the research are linked to the implementation process, but most importantly to the sustainment of those evidence-based programs. So here are 2 examples that have capitalized on these different tenets that are associated with the conditions that seem to be going in the right direction.
Yes.
That's great. I'm going to turn to the answers to our poll, and then I'm going to give Peter an opportunity for what the Car Talk guys called the shameless promotion part of the show to talk about a recent report from Casey Family. So Carmen, can you give us the results?
Yes, of course. The question was, what is the most important issue that has been discussed so far? Coming in first at 35% is creating a culture of evidence-informed decision-making within child welfare agencies. Next at 28%, best practices for using research to inform decision-making. Then at 20%, challenges facing child welfare agencies when using research to inform decision-making. And then at 17%, the need to build research practice partnerships.
Great. So Peter, tell us a little bit about this document and how you might like it to be used. I'm not sure we've even mentioned the document earlier.
Catalog?
Yeah, the catalog.
I will talk about it now.
Okay, good.
Thank you. I do want to mention that the report about New York City's implementation of evidence-based practices is up on the Casey Family Programs website. If you do New York City and evidence-based practices as your search terms, you'll find it. I thank you so much for mentioning that. It was an honor for the folks in Allison as a co-author on that to tell that story, and the funding and support that WT Grant, NERN, and others did, I think it's remarkable. Large system, not a huge amount of money to spend necessarily on evidence-based programs, but to have that be implemented and sustained in the way that you've mentioned, I think is a real tribute to the folks and the stakeholder agencies, as you guys have mentioned, that have helped to do that. The document that you have that was sent out electronically actually is informed by everybody's work on the panel, because the use of data leaders or data scientists, the folks that New Jersey has done, the evidence-based work from NERN, the landmark work that the WT Grant Foundation under the leadership of Kim has been doing for a number of years in this area, all were used to shape this. But I did want to just underscore that, you know, if we really want research information to be used in agencies, I just want to underscore what folks said here, that we've got to understand whether the organizational culture, the organizational climate, and the leadership there can provide a foundation for that, for supporting regular, routine translation or use of research into everyday, as Kim mentioned, budget, policy, program decisions. So we don't want to leave off the important nature of how an organization's culture, climate, and leadership play. This is not all about techniques, as you've heard the panel members mention. The document does provide a catalog of strategies drawn from several fields: psychology, social work, public health, education. And it draws from various research traditions, some of which you've heard about: implementation science, utilization-focused evaluation, social R&D that we wrote about many years ago, 1980s, and translational research. So it tries to draw from a variety of those bodies of work. And it's really intended to offer strategies, examples of their use and impact, and key factors for consideration to help researchers and organizations develop approaches that will improve knowledge sharing among practitioners, managers, policymakers about how best to serve children and families. So that's really, there's an upfront essay which is trying to reflect some of the wisdom in the field, and then it's followed by a set of strategies that then have those components that I've mentioned. We really, just to underscore what I think my colleagues here have said, one of the keys to success is really establishing a non-blaming and forward-thinking learning culture in organizations, right? Because with data comes new learning. And with data you go, oh my gosh, we're not serving that subgroup of children and families as well as we could. That's Kim's opening remark about. It's not just an evidence-based practice, it's about information about who are we serving well and who are we underserving. Who is lagging, stuck in foster care for 2 years or more? What groups of children are we disproportionately placing in group care for long periods of time when they should be getting high-quality behavioral health interventions in their own home? Those can be, I think we said at lunch, those can be difficult conversations to have, and yet you've got to have a learning culture that supports that. So I just want to draw people's attention to and underscore what my colleagues have said here about the culture and values approach to this work that I think is embedded in some of the strategies there, but if you quickly reviewed the catalog, you'd miss it. Just to get to the nuts and bolts, and this is going to restate a little bit about what Kim had mentioned. There are 6 buckets of strategies that you'll see in the catalog. They're encapsulated by an infographic on page 4 of the catalog. Those are the buckets. I'll just quickly read them off to you and then stop for the next questions. But they're all about developing trusting relationships with the end users, and that's where the W.T. Grant Foundation work really informed our work and influenced it. Trusted intermediaries was, I think, one of the terms that Kim used early on that just seems to ring true. A trusted intermediary, a person that Allison had mentioned about, someone you can turn to who will listen to you and problem solve jointly with you around an issue. And hopefully that's someone from a local research center or a university that you can regularly turn to for that advice. So that's that first bucket, and then that concept out of the W.T. Grant work of a trusted intermediary, I think, has been one that I think has inspired us. Second one is just encouraging this open and productive communication. You've heard that from the panelists so far. Third is engaging stakeholders and advocates through real conversations, not just lecturing at someone about your findings, but real conversations about what does that mean, how do you interpret that. A fourth is making research accessible. So I know we all love 80-page, 90-page, 200-page technical reports, but unfortunately no one reads those except for some of our fellow researchers who want that technical information. So how do we use infographics, 2-page summaries, compelling case stories combined with statistics to really grab the attention and make our findings very worthwhile and accessible is our fourth strategy that we've learned from everyone here. The fifth is increasing stakeholder investment, which means how do you engage people so they really see the value in the research data or the intervention or the finding that you have. I love New Jersey's example that we're now trying to disseminate around visitation to help maintain foster parents. The New Jersey child welfare system front loads the visitation of that new placement so that the caseworker goes out more often than the first 6 to 9 months of the placement and then slowly moves back to a once-a-month type of visit. That's an example that comes out of research and practice wisdom that is the kind of nugget of information that should be in every child welfare system across the country, and yet we don't make that information very accessible to people. We don't engage people around the value of that kind of practice wisdom, and that's an example that we take to heart with us in some of our work. And finally, helping to ensure the sustained use. As people have said, how do you develop a routine and a culture within an organization where you regularly go back and look at information and data to try and make better use of it. So thank you. That's what's in the catalog, and we were honored to be able, the ideas from the catalog actually came from a number of the panelists here who were also at a meeting that we convened in Chicago, and that's where this came from, is out of the stakeholders that came to that meeting. So back to you, Matt.
Great.
Thank you.
Allison, did you want to reflect a bit on the culture of the agency issue or any other things that are on your mind from this conversation?
Yes, I would. So something that has been coming to mind throughout this afternoon's discussion is I have a colleague who really was my partner in this whole effort at DCF, who frequently begins presentations by saying, right, in public child welfare agencies, we all want to do better, right? We're always trying to do better and looking for strategies to implement so that we can. But you know, when you think about the culture and culture change, in my experience at least, you know, running a large system, you really have to create an area within the infrastructure, right? You have to devote resources to the development of evidence, to support for identifying, you know, which EBPs or evidence supported or promising practices are going to make sense for the populations that you're working with. Right, you have to, you know, have not only quantitative data analysis capacity, but you need to be able to understand and collect qualitative data, and you need to have research practice partnerships. But I think that, you know, one other thing I just want to say about this is we talk to each other, right? Public child welfare leaders talk to each other. We're fortunate that Casey Family Programs creates opportunities for us to come together a few times a year, and so in New Jersey, we were looking at what was happening in New York City and really thinking, you know, this was the direction we wanted to go in. And we're fortunate in that another foundation that practices in this space said, well, what would it take for you to do what New York City is doing, right? And I said, well, we would need resources, right, for planning, for implementation, for technical assistance, right? We would need assistance engaging our stakeholders. And so working with NERN, with Allison, we were able to develop a blueprint, right, to identify which evidence bases were already being utilized in New Jersey, had been implemented successfully, and which made sense in terms of a next step, right? So that we could then begin to think about how to implement them, how to scale up, and then how to support them. And, you know, Kelly's been a key partner in that. But you know, it's that a lot of that work comes with transparency, right? When you think about the buckets that Peter talked about, both your internal stakeholders, your staff, and your external stakeholders, right? Folks in the community need to understand why you're making the decisions you're making, what the data is that's informing those decisions. And also, you kind of going back to Kim's earlier remarks about the budget, you know, for me as a commissioner, I had to go before the state legislature twice a year, and I had to defend how, right, state funds were being spent. And so being able to say, we're going to fund this new service or we're going to expand this service, and there's evidence, research evidence to support this investment, right, that's likely to yield a lot more support for child welfare services than if you're just saying, well, I think this is the right thing to do, right? Because you need a little more than practice wisdom. You've got to have some evidence, some data to support that. And I think that brings culture change both throughout the organization, but with your external partners as well.
Great. I'm going to go to our final polling question, and then I want to come back to before we go to the audience and get some brief reflections on Family First and how you think that might play into this issue of evidence use in child welfare. So our final question is to ask our audience what they think the greatest challenge is to the use of research to inform decision-making in child welfare. The first couple focus on the researchers. The second couple focus on the users. So think about, from your perspective, which those are, and we'll come back and then ask the panel to reflect on that. But before we do that, and before we go to audience and web questions. Any thoughts about this? We love surprising news out of Washington these days. It's nice every now and then to get some of this kind of surprise that really the most significant change in child welfare funding in many decades is coming down to the states, and there is a call out for the use of evidence, but I'd really love to hear each of your reflections on that. Allison, you seem anxious to jump in on that. I don't know.
Who, me?
Yeah.
Oh. So I think it is an exciting time, but I think it also will present new challenges, right? Because as you've heard from every member of the panel, there's a limited number of evidence-based programs or services available to child welfare agencies right now, at least in terms of secondary prevention, right? Which is, I think, what's articulated in the Families First Act. And so, from my perspective, those research practice partnerships are going to be essential going forward, right? And there really need to be time devoted to helping public sector leaders develop those relationships so that they can identify the right strategies and services to implement to support children, youth, and families.
Other reflections, Kelly?
So as a practitioner that already is invested in using evidence-based practice and trauma-informed care, I think it's an exciting thing. I think that it will be hard for some agencies that have not gotten up to that point yet, because this is really, it is about survival, but it's about putting in place important services to get the best outcomes for families and children. I do also really appreciate, and something that we've talked about, getting the stakeholders' voices into research, but an important stakeholder that is often left out of research and left out of practice and policy is the family's voice and the people that are utilizing the services. So I do really appreciate that, bringing that into some of these services. It's all about involving families in the congregate care in a way that has not always happened. So.
Allison M., any reflections?
I want to echo what Kelly's saying about the involvement of families. I think that still seems to be often a missing puzzle piece when we look at how we generate and use evidence. And so I just want to echo just how critical I think that is. With the Families First Act, and Allison Blake and I have been having some conversations about this, and it is exactly what you said. It's a bit of, I think it will incentivize some good things, but I think it will also cause some challenges. And one of the things I'm really cognizant of is, again, if we're going to be emphasizing the use of, and this seems to be focused on evidence-based practices and programming, is that the lack of sustainability of those practices is often due to support insecurity. So the idea that there's not ongoing support for those practices past uptake periods, or there's not a sense of mutual accountability for what it takes to both continue to productively adapt them in a system, build the competency of practitioners, use data on a regular basis. Again, most public agencies are not using single EBPs to solve complex challenges. They are using multiple strategies. They have typically practice models that have many tentacles, and evidence-based program is one piece of a puzzle that is often targeted to specific subpopulations. And the idea of how those puzzle pieces are integrated and sustained takes teaming, it takes data use, it takes leadership support, it takes coaching. And I think for the most part, what we've learned is that when we start to incentivize or mandate these types of things, that doesn't necessarily lead to the infrastructure supports that are necessary to be able to do it well. And I think we've had some lessons learned with that over the last 8 or 12 years, where federally we have incentivized evidence-based programming in different areas, whether that's in home visiting or teen pregnancy prevention. And the challenge is that there's a great demand for those kind of programming and not a lot of supply. And I don't mean supply in terms of just the practices themselves, the what, I mean supply around the how. So the idea of qualified intermediaries that can come in and actually support sustained capacity building. I think that is going to be just a really big challenge going forward, and something we could probably talk about endlessly, but yeah.
Kim?
So I don't have much to add. I might say it a little differently, that it's great that there are these incentives here. The caution is that the evidence-based program and the use of them don't become the end of itself. So I think that should just be very clear. We'll need to pinch ourselves once in a while. And then in terms of the opportunity, it's an opportunity for researchers to maybe raise to the challenge around this very specific initiative to be good partners. And so that's exciting opportunity to understand if it actually makes a difference to outcomes, to build the conditions and supports that need to do this work. And an opportunity for other intermediaries who are in this space to learn from NERN and the work of these community development teams on ways they might adjust their practices to better support the kind of work in the ways that we saw, because there's different levels at which you can come in. So.
Excellent. Peter, a final word on that, or shall we turn to our poll response?
We could talk to the poll
Okay,
response.
great. Let's see what people noted as the challenge.
Okay. The question was, in your experience, which of the following is the greatest challenge to using research to inform decision-making in child welfare? 50% of the audience said potential users do not have time or other resources to find and use relevant research. The next most popular, at 25%, potential users don't have enough flexibility in their work to try things suggested by research. 19% said research products are too technical, and 6% said researchers don't address questions of interest for potential users.
So I can't help but point out that 60% of our audience is researchers, but 50% think the problem with research use lies with the users.
Only a small percent think it's because the research is too abstract.
So that's, we will come back to that. But let's open it up. We have about 15 to 20 minutes for audience questions. I'm going to start with the web, our patient audience out there that we can't see, and then I'll come back to the room. So Carmen, what's one of the questions the panel should address from our web audience?
You bet. So we have Michelle Widener from Family Justice Resource Center. The question is, while we applaud these research efforts, it seems like field workers are not equally committed to evidence-informed practice, particularly when it comes to managing medically based investigations. How can we get the research out of the ivory towers and integrate it into field practice?
Kelly, I might look to you first as the closest to the front lines
So,
to talk about that.
and being on the front lines, not necessarily in the public sector, I think that in my agency, we are hiring clinicians and case managers to do this work, and I do find that there is a lot of investment in doing what works, and that staff retention, what we have found that when we're involving them in the process and they know what they're doing and the outcomes that they're looking for, and they things are clearly defined, that they do stay for longer. So I don't know if that fully answers the question, but I do think that there is a difference between, getting the research. It's necessary to make sure that the people that are on the ground are understanding what the research is and what they're doing and how they can impact with the work that they're doing.
Allison, do you have a reflection from the public agency side?
I do. I actually, similar to Kelly's experience, I think that so much of this is again about the translation, right? So how does the frontline understand that the service, the intervention, the decision-making tool is evidence-informed, right? Like, who is their research practice partner, right, that is helping them to understand that or translating that for them? But in New Jersey, we had a similar experience in the public sector where our attrition rate was extremely low, and when we surveyed staff to understand that, it was that their job satisfaction rates were very high. They felt that their interventions were successful. And so I think some of this is really about, again, transparency and how you communicate with the staff.
So it sounds like there's a positive synergy between giving the front line more tools, supporting those tools, them staying longer, which then leads to more practice evidence, and possibly the opposite of that is you get higher turnover and less ability to do that. Allison, from your work across many systems, what would you add to this?
I think it just really builds on Allison and Kelly's thinking on this, but it's a lot about, again, what we talked about at the very beginning today around the extent to which folks who are delivering services are involved in the choices of the services they're delivering. And so, the idea of, because sometimes I think we talk about using research evidence, but I don't really know if a practitioner would think of it that way, because they're not, people aren't using research, they're using practices, right? So I think even the way we phrase some of what we're talking about up here would feel very abstract to someone. How do you use research? Well, I don't know. What would that really mean to a practitioner? A practitioner is using practices, they're using strategies, they have to be able to use something that's usable, that is compatible, that's feasible, that's really well defined, where they can see results. And I think we need to maybe just alter our language a little bit around this too, because even when I was kind of thinking of some of the questions today posed to us, one of my first thoughts was, well, I don't know. I mean, should we say that that we use research? And from our perspective maybe, but from a practitioner's perspective, I don't know. And I've done clinical work and seeing patients. I don't think thought I was using research. I thought I was using practices that hopefully were informed by research. But I think it's a twist of language, but I think it actually really matters.
Yeah, it's a really good perspective. And as a researcher, I think we naturally think of research first, and then we think of the use of it rather than taking the practitioner perspective of what do you have to offer me? How can I integrate that into what I'm doing?
And I'm in an urgent, consequential situation.
Right.
And so that's what I'm thinking about. And
Good. Thank you.
One of the things I was just thinking is Kim's point about how you bake things into the practice. I love that term too, because there's the evidence-based practice, and that's you're doing an intervention. But then there's this baking into everyday practice, research-informed things. And a couple examples here are just coming to mind. Maybe it's how we help define and populate the toolbox that child welfare workers have, and the expectation, so that when a family comes in that toolbox is an eco map, a genogram, a social network map, and a phone app or a tablet app for signs for 3 houses, for example, which is out in New Zealand. It's a Signs of Safety popularizes it. It's starting to sweep the country. 3 houses is the house of hope, house of worries, house of dreams. And it's a tool to elicit from youth and sometimes parents what they want to see happen in the case. What are their worries and dreams? Well, how do you help? There's a research base behind that, because it's involving youth and families in telling their story. And it builds in some motivational interviewing techniques too, because the child is drawing out what they see in the 3 houses. And it's been turned into 3 teepees by some First Nations peoples and elsewhere. But now they're putting it on apps, phone apps, tablet apps, so that line workers can more easily use a practice and research-informed practice technique. It's not a whole program, but it's a technique. And I'm just wondering if we think along the lines that you all are saying here, that it doesn't have to be a big, huge program. It can start with, what are the clinical techniques you use in everyday practice? And maybe that's a way we help lift up this in a way that feels more natural to people.
Well, it's interesting because a part of my role is also looking at training for staff and training in the different models that we utilize and the different trauma-informed framework. And in every training, we do the whole theory and research and give them the stats, but what people walk out with are the tools. And what they're always looking for more are the tools. So with any training, there's the 10% retention that they're getting from and walking away from. And really, I think it's necessary for the ongoing coaching and mentoring to keep on bringing in that theory and bringing in the research and what's behind it, while also helping them to utilize the tools and seeing how the two are connected. That's right. And so I think it really is about that, that even with implementing an evidence-based program, it's only going to sustain if you have that infrastructure underneath it. So you need to keep going back to the theory, to the research behind it, but then also helping them utilize the tools.
That's excellent. So let's take a question from the room here. And if you could introduce yourself and your organization, that would be great.
Sure. John Shimano with the Child Welfare League of America. Wanted to go back to something you had mentioned earlier in trying to fit maybe a round peg into a square legislative hole. But you talked about New York City and the 11 evidence-based practices, and that 10 of them really didn't fit into child welfare. So how did they go about selecting those? And maybe we can figure out some way to fit that into the final guidance on the legislation. So.
Yeah, so I don't know. So we came on board kind of after a list had been kind of generated around what they wanted to work with. But I will say that those choices were made around probably three things at the time. So the first was they wanted to have a continuum of care. So they wanted to be able to look at families that were high risk, moderate, and low risk, and ensure that they had evidence-based programming available that was matched to level of risk. And they eventually developed a tool to assess risk and create a match using an algorithm and with an available treatment slot in one of the 5 boroughs. I think the other piece of the puzzle at the time is they had had great success implementing a small amount of evidence-based programs in different sectors. So one was their program, and I'm forgetting what it's called in New York, Injustice, but also juvenile justice. When families bring a child to the attention of the system for truancy, it's part of their kind of family assessment program. Mm-hmm. And with that, after they'd had about 8 years of success with that on this kind of smaller scale, they identified which seemed to be the similarities among those programs. So that they were intensive, that they were home-based, that they focused on the family, right? So they started then seeking other evidence-based programs that shared those characteristics as they wanted to expand to a larger population. And then I think the third piece is they did look at administrative data, had conversations. They've since, as part of their waiver and other selections, have done more intensive needs assessments to continue to try and increase the match. And so when you bring in those models, I think that there's lots of opinions about these things, but that all models are translated into a context. They're not so much replicated. That's my personal opinion. And so it's working with developers around productive adaptations to the models. So those would be around things like assessment, visitation, supervision, how domestic violence is handled, because again, they weren't developed for a child welfare setting. But then it's also, how does the system tailor itself to accommodate for the models? And so a lot of the work that New York did was to go back and do something that took them upwards of 2 years, but it was to look at their practice standards that were compliance driven and absolutely mandated for their providers to adhere to, but those standards were actually out of alignment with fidelity criteria for the models. That's incredibly common, and it's just simply something we often refer to as policy practice misalignment, But the idea is that beyond referring to it as that, you have to be able to do something. So it's why what New York City did was so transformational, because the fact that they spent upwards of 24 months creating addenda to all of their standards to help accommodate for that. But again, the developers and the providers and families, it was all data collected from them, where they were also, the models were also going through some adaptations as well. So it's a journey from both angles, actually, in terms of how to do that. We could go on, but yeah, and so they're making decisions now on where it is they'll probably make bigger investments in some of the models.
Great. Maybe one more question from the web?
Yes, this question is from Rosanna Bess from Mathematica, and it's, what strategies would Allison Blake and Kelly offer to child welfare agencies to increase the use of data and continuous quality improvement processes at the worker supervisor level?
There's an easy one.
Yeah. I'm doing a presentation on this in 2 weeks if she wants to come, right? I know, yeah. So I think that it's, first of all, I want to say that like most things in large public systems, right, it really is a developmental process. And, the federal government now requires that each state have a statewide CQI, continuous quality improvement plan. And so I think it really is important for the leadership, right? It has to begin with the leadership really embracing the use of data to inform decision making. And what we did in New Jersey that we found to be very effective, which is something Peter spoke about very early on, is we really were striving to become a learning organization. And so instead of thinking about using data as a gotcha, really thinking about using that data to help you understand successes and opportunities for improvement. And I think as you model that for staff and they see that, that you've shifted away from people being in trouble or somebody being on the front page of the newspaper, and you've refocused to thinking about how the system continuously corrects itself as it looks at practice, I think that changes the culture, and it helps staff to then think about how to use data to inform their decision makings. And then you need to really focus on developing their skills. In New Jersey, we were very fortunate. We had a federal grant that helped us begin a program that Casey Family Programs later helped us sustain, which was called the DCF Data Fellows. And so we made a commitment to train middle managers across the state in how to use data to inform decision making. And as a leadership team, we made a commitment to work with the new cohort every year to identify what the current agency's concerns were, what practice issues, whether it's anonymous calls to the hotline or repeat maltreatment, reentry, what have you. And we charged the newest cohort with that being the focus of their investigation that year. And then we use the results of their findings to inform planning and decision making at the system level. So it's kind of, I think for leadership, it's really putting your money where your mouth is, right?
Kelly, did you want to add anything to
So
that?
similarly, at Family Connections, we have a culture that really supports constant quality improvement. In this past year, our executive director worked with the board as well as the executive team and getting feedback from, we always do staff satisfaction surveys, consumer satisfaction surveys, focus groups every single year. From all the stakeholders that we're involved with to really get information about how we can improve services. And to the point that this year we've put in our strategic plan that we want every single aspect of the agency, so not just programs, but our finance department, IT, every part of our infrastructure to strive to be the standard of excellence as an agency and within their program, within their individual teams. And another thing that we've done as an agency for years now is we have an annual quality improvement fair in which every single program, every single team looks at all the data that they're receiving from all these different consumers and stakeholders and from the team itself. And everyone's a part of the process from a driver to, that's driving kids back and forth to visitation to the executive director, really determining what can we improve and how can we make a small change to look at our outcomes. And we share outcomes, good and bad, at that fair.
Great. I want to remind folks that I'm sure there are many questions we didn't get to, but we will have the opportunity with the Twitter chat coming up on April 5th at 12 noon Eastern. Most of our folks here will be available, and we'll have a continuation of this conversation, which I'm realizing could have been a 3-day seminar. I think from the richness of everything
no,
that
we wouldn't have.
we wouldn't have had this group here. Well, I'm glad you got it all out. But I wanted you to just have a chance for a 2-sentence take-home point that you might want to offer to the audience, something that came up today that you think is a gem that, or something you'd like to re-emphasize that people take away as they think about this. And I'll just look for a volunteer to go first on that.
So I'll go, but I'm going to use my 2 sentences to go back to the ivory, getting people out of the ivory question tower, because I thought
Good.
that we talked a lot about how to make the research that comes out of that ivory tower more accessible and the tools that might facilitate that, but not how to get folks. And I would say that rethinking the incentives and the funding and rewards for doing research in a different way is a part of that. And there are some funders who are starting to do that. You could look at the Research Practice Partnership funding at the Spencer Foundation, at IES, at NIJ, childcare, and also at the William T. Grant Foundation. We recently launched an institutional challenge grant to not only support the work of the partnership, but to challenge the research institutions to think about how their policies and practices might change to better facilitate long-term, sustained, problem-based partnerships.
That is excellent. And you have 2 schools of social work represented here that
Yes.
can apply for that. So I think that's a really important point. This is a 2-sided coin, and we can sometimes stare at one face of it and pick it apart, but we need to be thinking about both sides of that.
And my one other sentence is that for us to think it's been successful, I'd like to see us move the needle on, in the way that it's already moving for children, youth, and families.
Right, right. Ultimately, this isn't about supporting staff or agencies. It's about better outcomes for children and families. Anyone else? A final thought.
Well, I'd like to raise up something that Allison Metz mentioned. So the idea of implementation practitioners, I think that we've really highlighted the need for research practice partnerships, but there does need to be an intermediary, right? There do need to be individuals within these organizations, whether they're nonprofits or publics, who understand how to implement and support evidence-based programs. And I think that that's an aspect of the workforce that hasn't really been developed well yet that needs some attention.
Can I put a little plug in around that?
It's shameless promotion time.
I just did.
This is my part. So this is really brief, but on this summer, June 13th and 14th, NERN has partnered with the Jordan Institute for Families at UNC School of Social Work to do a summer institute on implementation practice. So what that means is not implementation research or a lot about implementation science frameworks. There'll be a little bit of foundational information, but we're really targeting public agency leaders and nonprofit leaders to attend to really focus on how we bolster the workforce around supporting the skills needed to advance change effectively. So our center released a set of competencies this last June that are fully focused on the practice of implementation, so how you build teams, how you cultivate leaders, those kinds of things that when you're kind of called in to do this work, what is it you're actually doing? Because we need to be able to train our social workers and psychologists and public health folks that are coming out of especially graduate school programs that are going to go into macro level positions to be able to utilize their clinical skills at a macro level, because a lot of the work that we do requires facilitation skills, things like that, that are incredibly important to teach folks. So we're actually piloting our first institute this summer that will focus on practice.
Great. Kelly, take home point?
So what I'm going to be taking home is that I'm going to be attending that conference.
Allison's going to be attending. I'm trying to convince here. I've already called some of your colleagues. I'm getting Kim to come. Yeah. So,
So that sounds wonderful, and I think one thing that I just think is really important to drive home is that we all need to just listen to each other because
Yes.
we all come from such different places, but really all the same, going towards the same outcome, which is great outcomes for families and children. And so just really researchers and practitioners, and whether you're public or private sector or from a foundation, I think just everyone listening to each other. And we were talking about this prior, just the importance of communication really means sitting and listening and hearing the other person's perspective. So.
Great. Peter, final word.
Where child welfare practice needs to go, if you look at the research and if you listen to families, is it has to move to an upstream, more non-blaming, more family support, more public health-oriented collaboration, wider system. And the Families First new federal law will actually provide some dollars and some incentives to help do that. And so how do we do that smartly? And how do we do that with local, as you've heard from folks, local university, local research center, agency partnerships to do that thoughtfully? And I'll leave folks, or to the scientists in the room, with something that's being talked about, which is called the need for a T-shaped professional in our field. And a number of the top doctoral programs actually use this as a structure, and I wouldn't be surprised if Mathematica wouldn't adopt this in a heartbeat in terms of your professional development work. But as a T-shaped professional, think of a T, is a person who knows how to apply knowledge across different disciplines. So some of the intermediaries that we're talking about that we really need is we need researchers and folks who have like communication negotiation skills, empathy, the ability to see other people's viewpoints, creativity, innovation, and valuing that, thinking outside the box, and understanding the substantive expertise that other disciplines bring to the nature. That's the top of the T. And then the stem of the T is deep subject matter expertise that person brings to the job, whether that's public health, psychology, social work, nursing, whatever. And I love that concept because it sort of reinforces some of the values and skill sets that people on the panel here have been talking about. You've got to have the ability to play well with others and respect and integrate and listen and lead teams well, but you also bring your subject matter deep expertise. And so that term, T-shaped professional, is starting to shape some of the doctoral programs across the country, and I'll leave you with that.
Very nice.
Oh, I think so.
I want to thank our audience. I want to thank our Mathematica team and Sire. I want to urge you all again to continue this conversation on April 5th. There's also an electronic survey for those of you who joined via web to let us know what you thought of this. I hope you, as I did, thought this was an incredibly rich and dynamic discussion that made me want more. And I appreciate especially our panelists coming and taking time. As you can tell, they have much going on in their lives, but let's give them a round of applause. And I thank everyone. I hope you can join us next time.
Thank you.